So we are going to talk about the infections caused by human papilloma viruses. First, we'll talk about the virology of human papilloma viruses. So human papilloma viruses, they belong to the family Papillomaviridae. The genome is double-stranded circular DNA genome. Right? When you talk about the DNA viruses, all the DNA viruses have double-stranded DNA except parvoviruses. That includes parvovirus B19. So only parvovirus B19 is single-stranded DNA genome. But all the other DNA viruses have double-stranded DNA genome. But out of that, there are only few double-stranded DNA viruses that have circular genome. So human papilloma virus has a circular genome. Hepatitis B virus that comes to under Epidermodysplasia family belongs to they have circular genome, and also polyoma viruses that include BK virus and JC virus. So they also have a circular DNA genome. So human papilloma virus, the genome is double-stranded circular DNA genome. And the viral symmetry is icosahedral. That means its nucleocapsid is icosahedral. If you remember, all the DNA viruses are icosahedral symmetry except pox viruses. That includes smallpox and molluscum contagiosum virus. So those pox virus family, their symmetry is complex symmetry. All the other DNA viruses have icosahedral symmetry. Then the envelope is not the virus is non-enveloped. There is no envelope, so it's a naked virus. That means the virus have some resistance to environmental conditions. They can tolerate drying conditions and they can tolerate heat to a certain extent. So they are resistant because their viruses are non-enveloped. And also the human papilloma viruses include close to 100 genotypes. Then we'll talk about how the human papilloma viruses, the transmission of human papilloma viruses. So these are human papilloma viruses. That means they are obligate human pathogens. So they can live only within humans. So how the common means of transmission is direct contact. So the virus can enter through a break in the skin, or maybe to the intact mucous membrane. So the viruses cannot enter to the intact skin. They can enter only through a break in the skin, but the viruses can enter through intact mucous membrane. That is how they enter our body. Right? Then also viruses can be transmitted through the sexual intercourse. So that is the common means of transmission actually. That's another common means of transmission. Then also viruses can be transmitted to the baby during the passage through the birth canal, meaning during delivery. The newborn baby can be infected during delivery. Virus also can be transmitted via fomites, meaning inanimate objects such as furniture, bathroom floors, doorknobs, towels. So those come under fomites. Then also it is very important to understand people shed the human papilloma viruses without symptoms. That is asymptomatic shedding. This asymptomatic shedding is very common. That is why the human papilloma virus infections those infections are very common. So we'll talk about the common types of human papilloma virus infection. One of the most common types of human papilloma virus infections is cutaneous warts. So there are three types of cutaneous warts. Common warts. These are the most common type of warts. Common warts. Most common type of cutaneous wart, also known as verruciformis vulgaris, is caused by human papillomavirus types 1, 2, 4, or 7. So they have well demarcated hypokeratotic papules with a rough surface. So there are well demarcated hypokeratotic papules with a rough surface. They are commonly located on the hands and in between fingers. And also these warts are very common in people who have frequent injuries to their hands, such as meat packers, fish handlers, butchers. So they are in those people these common warts are very common. Then plantar warts. also known as verruciplantaris, usually by human papilloma virus type 1 or 2. They can be painful. So these lesions look like raised bundle of soft keratotic fibers. Their size can vary from 2 millimeter to 1 centimeter in diameter. And these are also known as myrmecia. Myrmecia is M-Y-R-M-E-C-I-A. Myrmecia is the Latin word for anthill. That is because the lesions have the appearance of ant hills. Right? So plantar warts, occasionally the plantar warts can appear on the hands too, on the palms. The other common type of cutaneous warts is flat warts, so plain warts, also known as verruciplani, usually by types 3 to 10, 3, 4, 5, 6, 7, 8, 9, 10. So they are usually multiple, slightly elevated from the surface, right? But the surface is smooth. So those are flat warts or plain warts. Then another clinical manifestation of human papilloma virus infections is Epidermodysplasia verruciformis. Epidermodysplasia verruciformis is a genetic condition, an autosomal recessive disorder with the affected gene is on chromosome 17. Right? Usually the infection occurs by human papilloma virus type 5 or 8. Right? So these patients, they develop multiple warts throughout the body during the first decade of their life. So during the first decade of their life, they develop multiple warts. Right? So these warts undergo malignant transformation, commonly malignant transformation to squamous cell carcinoma during their young adulthood. During the young adult period, the malignant transformation occurs, and they are transformed. The malignant transformation is usually to squamous cell carcinoma. Right? Usually the transformation occurs on the sun-exposed areas of their body. And these patients have depressed cell-mediated immunity. But it is very important to understand this depressed cell-mediated immunity is only against human papilloma virus. They are resistant to other pathogens is normal. So for against other pathogens, immune response is not depressed. Then another common type of clinical manifestation is anogenital warts by types 6 or 11. Right? So they are transmitted only by sexual activity. So they usually the patients present with flesh-colored or grey-colored hypokeratotic papules, and these lesions are commonly they are pedunculated. Sometimes they can be sessile. In circumcised men, they usually occur on penile shaft. But in uncircumcised men, they occur deep to the prepuce. In some men, the distal 3 centimeter of the distal 3 centimeter of the urethra is involved. In women, most lesions occur around the posterior introitus, meaning around the vaginal introitus. Lesions are also common in labia majora, labia minora, clitoris, perineum, vagina, cervix, and distal urethra. So there can be perianal warts. Usually they are very common in homosexual men depending on their sexual activity. Then malignant transformation. So some HPV types cause infection and they undergo malignant transformation. So this is common in genital infection by human papilloma virus type 16, 18, 31, 33, 35. Out of these, 16 and 18 account for about 70% of infections. So they are the very common highly oncogenic types are 16 and 18. So they undergo malignant transformation. There's another lecture that we will do in future that will include the mechanism of oncogenesis. Right? So there is usually the outcome is cervical intraepithelial neoplasia or CIN. It can be low grade or high grade, and cervical carcinoma, penile intraepithelial neoplasia, and penile cancer. So this malignant HPV infection and malignant transformation is very common in immunosuppressed people. Maybe due to AIDS or maybe after organ transplantation. Actually, immunosuppression is a major risk factor for HPV infection and malignant transformation. That is why when you get a patient with HIV infection, when you get a woman with HIV infection, if the woman is in the childbearing age group, so what we usually do a pap smear on the first visit. And then we do another pap smear after 6 months. Then after that, annual pap smears. That is because these people are more liable to develop HPV infection and they can develop invasive cervical carcinoma. Then another infection, not very common, but another clinical manifestation of HPV infection is recurrent respiratory papillomatosis. So the name indicates recurrent respiratory papillomatosis. So there is recurrent development of respiratory papillomas, right? So these are by genotypes 6 or 11, right? So this can occur, maybe infection can occur in young children, and this also may occur in adults. But so in young children, they acquire the infection during the delivery, during the passage through the birth canal. The baby gets the infection from the mother. If the mother is infected by this genotype 6 or 11, the baby can get infected. The virus enters the upper respiratory tract and virus multiplies in the upper respiratory tract, start forming papillomas. Right, so that they develop these symptoms. So not at birth. At birth they are normal, but after about 3 years only these papillomas are developed. So they develop symptoms around the third year of their life. Right. So they usually present with hoarseness, and sometimes depending on the severity they can develop stridor. In adult also, infection can occur, but is common in adults who have multiple sexual partners, especially those adults who have orogenital sex. So because that is the virus enters the upper respiratory tract, result in recurrent respiratory papillomas. So they usually present with hoarseness, and with time sometimes the infection can involve the lower respiratory tract also.